randomized trial of platelet-transfusion threshold in neonates. Definition: thrombocytopenia is a condition in which a person has a low blood platelet count. Platelets are colorless blood cells that help blood clot. Platelets stop bleeding by clotting and
There are three different sort of cells that we have in our blood. One are white cells, one are red cells. The white cells help us fight infection. The red cells are what give us oxygen, carry the oxygen, and the thrombocytes, or platelets, are what make our blood clot. The incidence of thrombocytopenia, the disorders that we just discussed, is on the order of 1 in 1,000 to 1 in 2,000 newborns that had this while they were in utero, rather than just a problem for
plugs. Platelet transfusions may be given to prevent bleeding when the platelet count falls below a certain threshold, prior to a procedure, or to treat bleeding associated with a thrombocytopenia or platelet function.
Exactly what can happen. Platelets are tiny cells in your blood that form clots and stop bleeding. If you've ever fallen off your bike or cut yourself shaving, you've seen them in action. But these little cells do their best work helping cancer patients who often lack platelets due to the cancer or as a side effect of treatment. Platelets also prevent blood loss in patients undergoing surgery and organ transplants. Without platelets, patients wouldn't survive. They save lives every day. The challenge? Platelets are in constant demand by hospitals. And because platelets must be used within 5 days, new donors are needed every day. That's why we need you. Platelet donation is a little different than giving.
Pros and cons. Pros. It's a life-saving approach for the treatment of thrombocytopenic patients with hematological disease, cancer, of those undergoing surgery. Cons. Patients receiving pheresis platelets are likely to have a higher risk of hemolytic reactions if they are ABL mismatched, and a higher risk of acute lung injury.
My name is Gaetano Chirico. I'm the director of the Neonatology and Neonatal Intensive Care Unit in the Children's Hospital, Ospedali Civili, Brescia, Italy. The main message I wish to underline in this review on red blood cell transfusion in preterm neonates is the importance of a preventive approach. Indeed, preterm neonates, especially very and extremely low birth weight infants, due to the anemia of prematurity, may be transfused several times during their hospital stay. However, red blood cell transfusion, in addition to the well-known adverse events, may induce
Transfusion in children has proven to be an effective practice, the impact of which results in a decrease in the risk associated with transfusion and hospital costs, with no evidence of unfavorable consequences for patients.
There are three different sort of cells that we have in our blood. One are white cells, one are red cells. The white cells help us fight infection. The red cells are what give us oxygen, carry the oxygen, and the thrombocytes, or platelets, are what make our blood clot.
Among preterm infants with severe thrombocytopenia, those randomly assigned to receive platelet transfusion at a platelet count threshold of less than 50,000 per cubic millimeter had a significantly higher rate of death or major bleeding within 28 days after randomization than those in the group that received less than 25,000 per cubic millimeter.
Any transfusion is an invasive procedure and that puts the preterm baby at risk of various complications. Hence, we should offer good monitoring on all these babies who receive transfusion. In this webinar, we will discuss the monitoring of babies who receive the blood component transfusion. Here, we will learn what monitoring is needed for the babies receiving the transfusion.